Said it's a hot girl summer.
This is y'all. This is why we act like this, me and Sheree. Cause look at my mama. Mama, let me see you. Let me see you, mama. This is why we act like that. This is why we act like this, y'all.
Sha'Carri Terry was in the Dominican last month for 2 body sculpting surgeries. After her arrival, her mother tells us the plastic surgeon demanded more money. And by the time the family arrived on the island, the young woman was unconscious and on a ventilator. She was later pronounced dead. An autopsy later determined Sha'Carri died of cerebral edema, which is swelling caused by fluid trapped in the body's tissues, pulmonary edema, and respiratory failure.
That right there is the local news breaking this story to Indianapolis. A 31-year-old mother flew to the Dominican Republic to get her body done, and she never came home. The doctor who operated on her said nothing publicly, and the clinic gave the family no real answers. And what we found out about this doctor's history will make your stomach drop. Stay with us. This story was a pattern that Sha'Carri did not realize till she died.
We're gonna keep fighting. We will not stop at all. Sha'Carri was a very important person.
Sha'Carri Nicole Terry was born on August 5, 1990, and she grew up in Indianapolis, Indiana. She had a twin sister named Sheree, and by all accounts, those two were each other's person. They would argue, make up, argue again, and be back on the phone the same night. That is just how it is with twins sometimes. And their bond ran deep even when they did not agree on everything. Sha'Carri was a mother too. At the time of her death, her baby was only about 2 years old. She was out here building something real while raising her child, because she owned and ran her own business called Mini Blessings in Paradise Ministry. It was a faith-based daycare on the east side of Indianapolis that served kids from the neighborhood who needed somewhere safe and warm to go. She built that from the ground up, but Sha'Carri had been carrying a heavy weight long before any of this. Her mother, Tammy Brewer, talked about it plainly in interviews that Sha'Carri had struggled with her body size since she was very young. Being a big girl at a young age is always not good, is how Tammy put it. Sha'Carri was bullied growing up, and that kind of pain stays with you. For a lot of women, especially black women, the pressure around how your body looks does not go away just because you grow up. And for Sha'Carri, it had been there her whole life. So when she got to her early 30s and decided she was going to do something about it, nobody around her was surprised. In December of 2021, she traveled to Mexico and had gastric sleeve surgery, which is a procedure where doctors make the stomach smaller so you eat less and lose weight.
This wasn't Sha'Carri's first surgery this year. She posted on her Facebook back in February that she got surgery. Her family says it was a gastric sleeve surgery that she got in Mexico. Just a few months later, on April 11th, her family says Sha'Carri went with her friend Carlisha Williams to the Dominican Republic.
So she definitely was healthy. Everything went wrong. It happened there.
They both had surgery for a Brazilian butt lift and a tummy tuck. They say the surgery was performed by Dr. Jose DeSena, seen here before the surgery.
She was posting about it on Facebook, showing her progress, and by March of 2022, she was down around 70 pounds. Her family said she was healthy, motivated, and genuinely happy. She felt like she was finally getting the version of herself she had always wanted. But losing that much weight fast leaves your body looking different than you expect. The skin changes, the shape changes, and Sha'Carri wanted to do a few more things to complete the transformation. She also had old butt implants from an earlier surgery that she needed removed, and when she went to doctors in the United States and asked them to take those out, they told her no. Nobody would do it, and so she started looking for options overseas. That is how she and her childhood friend Carlisha Williams ended up booking a trip to the Dominican Republic. The DR has become one of the biggest destinations in the world for affordable body surgeries. And a lot of Black American women specifically go there because the prices are a fraction of what the same work would cost in the US. The packages are set up to look very smooth. Surgery, hotel stay for recovery, aftercare, all bundled together for one price. You wire the money, book your flight, and show up expecting to come back transformed. That is the pitch, and to a lot of people, it makes complete sense. On April 11th, 2022, Sha'Carri and Carlisha flew to Santo Domingo together. Both of them were scheduled to get a Brazilian butt lift, which is a procedure where fat is taken from one part of the body and injected into the backside to give it more shape, along with a tummy tuck. The surgeon handling both women was a man named Dr. Jose Decina, and the procedures were going to happen at a place called Instituto Médico San Lucas in Santo Domingo. Each woman paid around $17,000 for the surgery and the recovery package, and they brought the money in cash because that is what the clinic instructed them to do. That is common in medical tourism situations, but it also means that when something goes wrong, there is almost no paper trail to follow. For Sha'Carri, the list of procedures was even longer than just the BBL and tummy tuck. She wanted those old implants removed too, and Decina said he would do it. But the family says he charged her an extra $4,000 to $5,000 on top of everything else. So she was going into one operating session to have 3 separate things done to her body at the same time. That detail matters, and we will come back to exactly why a little later. Now, before we get into what happened in that clinic, we need to talk about who this doctor actually was, because this is where things start to get really troubling. Dr. Jose Decina was not a member of SODOSIPRA at the time he operated on Sha'Carri. SODOSIPRA is the Dominican Society of Plastic, Reconstructive and Aesthetic Surgery, and it is the main organization in the DR that certifies whether a surgeon is actually qualified and trained properly to do this kind of work. He had been a member at some point in the past, but he was suspended years before Sha'Carri's surgery because of problems with his work. SODOSIPRA is very clear on their website. If a surgeon's name is not on the member list, they are most likely not qualified to be performing these procedures. Decina was not on that list and had not been for years, and nobody told Sha'Carri or her family any of this before she got on that operating table. Both women had their surgeries at Instituto Médico San Lucas.
The second day into recovery, which was Friday, the 15th, Sha'Carri I was, moving around a lot more, and Sha'Carri, I was still in pain, but I was moving around. Sha'Carri wasn't really moving around. She wasn't doing nothing. She would lay in bed. I would go in there and try to get her out the bed, try to get her to come downstairs and eat with me, and she just wasn't responding.
Carlacia said she came out of it in pain, which is what you expect after something like that. But she was managing. She was up, moving around, and was trying to eat. Sha'Carri was a completely different story from the very beginning. Right from day 1 after surgery, Sha'Carri was barely moving. She would not get out of bed and was not responding well to anything around her. Carlacia tried to get her to come downstairs to eat, and it just was not happening. This is how Carlacia described it herself.
Sha'Carri wasn't really moving around. She wasn't doing nothing. She would lay in bed. I would go in there and try to get her out the bed, try to get her to come downstairs and eat with me, and she just wasn't responding well.
When Carlacia raised the alarm and asked about Sha'Carri's condition, the response she kept getting from Dr. Decina and the staff was always the same thing. She is just resting. The body needs rest. Everything is fine. Then Carlacia asked point blank, what if you take the equipment off her? And this was his answer.
So I'm like, so if you unhook that, she'll be able to breathe and stuff like that on her? He was like, oh yeah, she's perfectly fine. Like, her body just needs rest.
He said it was not a big deal, but it was about to become a very big one. Sha'Carri had to be transferred to a separate hospital called Centro Médico Escano SRL in Santo Domingo, roughly a day after the surgery, because her condition was getting worse and the clinic could not handle it. When Carlacia went to see her at this new hospital, she was not prepared for what she saw.
When we go in there and I see Sha'Carri, I almost fell out. Like literally, like she was on all these machines. She was unresponsive. And she wasn't talking, wasn't alert, eyes closed, she's unresponsive.
Shocker was hooked up to machines on supplemental oxygen, completely unresponsive. And the explanations from the medical staff kept changing every time someone asked a question. One doctor told Carlacia that Sha'Carri was having a hard time breathing on her own. Then Decina came back and said she was actually getting better and just needed dialysis, which is a treatment used when the kidneys stop working. But then in the same conversation, staff would say her kidneys were fine and she just needed rest. The family also noticed her skin was starting to look yellow, which is a sign that something serious is happening inside the body. Nobody was giving them a straight answer, and nobody seemed to be in a hurry to fix anything. Back in Indianapolis, Sha'Carri's twin sister Sheree got on a FaceTime call with her a few days after the surgery, and something felt deeply wrong the moment she saw her.
Me and my sister had the type of relationship where we could get into it 1 minute, and then right after that we'll be back friends and talk. And so I knew someone right. I felt it in my heart, and I've been just trying to get help.
Sheree told the family what she had seen. Their mother, Tammy Brewer, immediately started making arrangements to fly to the Dominican Republic. She had to reach out to the U.S. Embassy for help because of the language barrier, and because she did not trust that the clinic was telling them the truth. Tammy arrived around April 19th, and when she walked into that hospital room and saw her daughter, she believed she was already looking at someone who was already gone. Tammy stepped out for about an hour to collect herself. That is when the call came in. In Carlicia's own words, describing what Tammy told her.
So she was like, Carlicia, I went back to my room. She was like, I was probably there for about an hour. She was like, they called me and told me Shakori's heart stopped just that quick. I said, huh? She said, as soon as she went in, she said her daughter was already in a body bag that quick.
Sheree and Carlicia say they just want answers. I reached out to the State Department. They said they can confirm the death of a U.S. citizen in the Dominican Republic, and they're providing all appropriate assistance to the family.
We're gonna keep fighting. We will not stop at all. Shakori was a very important person.
Working for you, Adam Shooms, WR-TV.
Sha'Carri Williams Terry died on or around April 21st, 2022. She was 31 years old, and her 2-year-old child was at home in Indianapolis waiting for Mama to come back. The official autopsy done in the Dominican Republic listed the causes of death as pulmonary edema, cerebral edema, and respiratory failure, with sepsis also mentioned as a factor. In plain language, fluid in the lungs, swelling of the brain, and the body's breathing system shutting down. The family believed those findings did not tell the full story. They suspected the real cause was connected directly to the surgery, specifically the kind of complication that can happen when a BBL goes wrong and fat from the procedure gets into the blood and travels to the lungs or the brain. That is called a fat embolism, and it is the #1 cause of death associated with BBL surgery. But the Dominican Republic autopsy never confirmed it publicly, and the clinic said nothing. The U.S. State Department confirmed the death and said it was providing appropriate assistance to the family.
Tammy Brewer brought her daughter's body back home from the Dominican Republic more than 2 weeks after she arrived on the island. Sha'Carri Terry was in the Dominican last month for 2 body sculpting surgeries. After her arrival, her mother tells us the plastic surgeon demanded more money. And by the time the family arrived on the island, the young woman was unconscious and on a ventilator. She was later pronounced dead. An autopsy later determined Sha'Carri died of cerebral edema, which is swelling caused by fluid trapped in the body's tissues, pulmonary edema, and respiratory failure. The family says she also had sepsis. A plastic surgeon we spoke with says he sees patients traveling overseas for operations that may be riskier or done cheaper.
Complications can arise in surgery, and so if you go out of the country and if something goes wrong, what do you do then? You need to know that your treating physician is local and is available to take care of you 24/7.
Sha'Carri's body was eventually sent back to Indianapolis. A celebration of life service was held on May 14, 2022 at Phillips Temple CME Church. The family arranged a second autopsy in the United States, planned for around May 4th. They also set up a GoFundMe to raise money for legal action against Dr. DeSena and the clinic. But as of today, no results from that second autopsy have ever been made public, and no lawsuit against DeSena or his clinic appears in any public U.S. court record. Suing a doctor in another country is incredibly difficult, and many families who go through exactly this situation find that there is no clear road to getting any kind of justice. The system is set up in a way that makes accountability almost impossible when the doctor is overseas and the clinic stays quiet, and DeSena did stay quiet.
Well, we have made numerous attempts to contact Dr. Jose DeSena in the Dominican Republic. He has not responded to any of our requests. We will keep trying to reach him, however.
And tonight, the family tells us after trying for days, they expect Sha'Carri's body back in the U.S. tomorrow. There will be a balloon release for Sha'Carri Terry happening this Saturday at 4 p.m.
This will be at 5417 East 38th Street on the northeast side of Indianapolis, and we do want to pass along the public is welcome to attend.
Reporters from RT tried to reach him for a comment on Sha'Carri's death and got absolutely nothing back. DeSena made no statement, explanation, or acknowledgement that any of this even happened. Here is what makes Sha'Carri's story even harder to sit with. She was not the first person to die at this man's hands, not even close, and the people who could have stopped him had every reason to do it long before she ever booked that flight. In 2020, a woman named Bianca Melina de los Santos Corchino died after having cosmetic surgery performed by Dr. DeSena. That death was not just a tragedy, it became a criminal case. DeSena was convicted of involuntary manslaughter. A court of law found him responsible for that woman's death, and then they let him keep practicing. There was no permanent ban or loss of license. He walked out of that situation and went right back to the operating table. Patient advocacy groups who have been tracking his history put together a timeline of alleged deaths connected to him throughout 2020 alone, with names like Delina Marie, Monica Blue, and Marcia Petty-Killebrew showing up in communities like the Justice for Sha'Carri Terry group on Facebook. Some of those claims come from family members and community advocates rather than official records, so we cannot verify every detail. But when you see that many names coming out of the same time period are connected to the same doctor, the pattern speaks for itself. Then in April of 2026, 4 years after Sha'Carri passed, a young woman named Anieli Melisa Sanchez Castillo went to Dr. Decina for cosmetic procedures. She paid around $9,000 for the surgery. Her family waited outside the clinic for 10 hours, much longer than they had been told the surgery would take. When she finally came out, the first thing she said to her mother was that she could not breathe. Those were almost her last words as she died the very next day. After Anieli's death, Soto Supre publicly confirmed once again that Decina was not and had not been an accredited member of their organization for years, that he had been suspended long ago for problems with his surgical work. The president of the society, Dr. Aniceto Rodriguez, said this on the record to local media. And then Soto Supre added something that reveals the real problem here. They said they do not have the power to shut down clinics. Only the government can do that. So what they can do is confirm that someone is not qualified, and they can warn people. But a man with a manslaughter conviction and no valid credentials can still legally set up a clinic, still advertise online, take in cash packages from women traveling from other countries, and operate on them. Nothing in the system stops him. The numbers behind all of this are the kind that should be making headlines every single day. According to the CDC, 93 U.S. citizens died after having cosmetic surgery in the Dominican Republic between 2009 and 2022. Almost every single one of those people was a woman at an average age of 40, and it was getting worse over time, not better. The death rate went from an average of about 4 per year in the earlier part of that period to 13 per year between 2019 and 2022, with a peak of 17 deaths in 2020 alone. The year Decina was convicted of manslaughter is the same year 17 U.S. women died getting cosmetic surgery in that country. The CDC also found that 92% of those deaths involved a Brazilian butt lift combined with liposuction, and that 90% of the cases with autopsy results showed the cause of death was some kind of blockage in the blood, either fat or a blood clot that traveled to the lungs or the heart. These are predictable outcomes from high-risk procedures being done in environments with no real oversight. None of these women were being reckless. They were doing what people have always done, looking for a way to get something done at a price they could actually afford, the same way people cross borders for cheaper medication or dental care. The difference is that when a dental procedure goes wrong abroad, you usually survive it. The BBL, especially done by an unqualified surgeon doing 3 or 4 procedures at once on a patient who just had major surgery a few months earlier, is a different situation entirely. The risk of fat embolism from a BBL goes up dramatically when multiple procedures happen in the same session, when the patient has a recent history of other major surgery, and when the surgeon is working in a high-volume environment without proper credentials. Sha'Carri checked all of those boxes, and nobody told her.
WRTV reached out to a doctor who specializes in plastic and reconstructive surgeries for Eskenazi, Methodist, and IU Health. He said traveling overseas for plastic surgery is a growing trend.
Dr. Ivan Haddad said since last summer he has seen at least one patient a week at his practice at Eskenazi who had previously left the country for plastic surgery. He said some had complications from those overseas surgeries and some did not.
I would say it's like 50-50 in that there's a number of patients that, had the operation that they wanted and had a adequate result. But then, it's basically a coin flip where the others, have some complications, some that are, expected, some that are not, or the result wasn't what they expected.
Dr. Haddad said fairly often he sees patients that have traveled to another country for surgery. So before you get any kind of procedure here in Indiana, you can look up a doctor and check out their qualifications, disciplinary history, and any claims of malpractice. Just go to the state's website, in.gov, and find the Medical Licensing Board of Indiana section. Once you are there, scroll down to the consumer patient information. We will have a link to that to that site, rather in our story at WRTV.com.
Soda Cipri gives clear advice on their website. Before you book any surgery in the Dominican Republic, check the official member list. If the surgeon's name is not there, do not let them touch you. Do not let a low price or a smooth website talk you into skipping that one check, because that check is the difference between going home and not going home. Her twin sister Sheree said it plainly in the days after her death.
With a heavy heart, Sheree Terry reflects on the life of her twin sister.
And she went to go get her body done in a DR, and she never made it back.
Sha'Carri Terry was a mother to a 2-year-old and the proud owner of the Mini Blessings in Paradise daycare on the city's east side before going to the Dominican Republic.
And me and my sister had the type of relationship where we could get into it 1 minute, and then right after that we'll be back friends and talk. And so I knew someone right. I felt it in my heart. And I've been just trying to get help.
This wasn't Sha'Carri's first surgery this year. She posted on her Facebook back in February that she got surgery. Her family says it was a gastric sleeve surgery that she got in Mexico. Just a few months later, on April 11th, her family says Sha'Carri went with her friend Carlisha Williams to the Dominican Republic.
So she definitely was healthy. Everything went wrong. It happened there.
They both had surgery for a Brazilian butt lift and a tummy tuck. They say the surgery was performed by Dr. Jose DeSena, seen here before the surgery.
We're gonna keep fighting. We will not stop at all. Sha'Carri was a very important person.
What do you think about Sha'Carri's death? Do you know anyone who has had a bad experience doing cosmetic procedures overseas? Let me know in the comments section. Click on one of the cards on your screen to see more videos like this.